Good morning. My name is Dennis McKenna. I'm the medical director for the hospital. I send my regrets that I'm not there today. I wish I could be. I'm actually at a previously scheduled appointment up in the Adirondacks working at a camp for children with my family, so I'm sorry I can't be there today. But Dr. Kilby asked me if I could spend a couple minutes addressing the class, and so I'm happy to do that. Let me begin by congratulating you in your next transition in your education to third year. I remember actually graduating from your medical school and Dr. Kilby's medical school. I graduated a little bit before her. I graduated in 1992 from Albany Medical College. I remember my transition very well between second and third year. I remember a couple emotions that I think at least some of you are probably experiencing. I remember being excited. I remember being nervous. But mostly I remember just thinking that this was what I really went to medical school for. So I hope you can take a moment to enjoy this, to have pride in what you've accomplished, and then be ready for the next transition in your education. So if I don't get a chance at the end of the session here, I just want to congratulate you and welcome you to the profession in the clinical years. Now, there's a couple of things that I'd really like to emphasize as the medical director of the hospital. And if I had more time, I'm sure I could speak at length on these issues. But let me just sort of address at a very high level 3 things that I want you to know as you enter these years. The first one is patient satisfaction. You should hear a lot over the next couple of years about patient satisfaction. And by that, what I mean is that in healthcare today, it is not enough just to simply take care of patients and do right by them clinically. Of course, we expect that. But in addition to that, there is more and more what I would call consumer pressure to make sure that we deliver healthcare in a way that's not only good from a clinical standpoint, but that the patients themselves think that the experience is a good one. And this is going to include a lot of what I would call the softer side of medicine. This is not necessarily the things that you read in a book, but the things that hopefully your mentors will teach you about good communication, about eye contact, about therapeutic touch, about sitting next to patients, about asking open-ended questions, about making sure that they know what your role on the team is, and about essentially treating them with courtesy and respect, answering their questions in a way they can understand, and thanking them for allowing you to be a member of their team. These are things that you will learn just like you'll learn how to listen for murmurs or how you'll listen to palpate certain organs, but I just want you to know that this is something that will take practice, it is important, and it is something that you should focus on over the next couple of years. I encourage you to find mentors, physicians on the floor who you respect, who you recognize as somebody who has a good way with patients, who delivers not only excellent clinical care, but does it in a way where the experience for the patient is one that is meaningful to them and that makes them feel at ease. Model yourself after them. Try to replicate what they do and recognize that this is a skill set that people come at with various degrees of skill in, and you can learn and get better at it. So I ask you to focus on that part of the patient experience. The second thing I want to talk about here is communication and specifically your role on the team. You will be walking around with a white coat on, you'll be having a stethoscope. People will naturally believe correctly that you're a member of the healthcare team, but they may not exactly know what your role is on that healthcare team. They may attribute to you certain attributes that in fact you don't have yet, as in you are the decision maker for their healthcare, or in fact they may not recognize you as a medical student at all. What is important is that you introduce yourself. Let them know how you fit on the team. Let them know who you work with and who you work for. Let them know what you're capable of doing as far as answering questions. And always, if they ask you a question that you don't know the answer to, tell them that you'll get the information and bring it back to them once you've discussed it with the attending physician. The medical center, like most other hospitals, often operates in a way where we act like a Tower of Babel. We have many different people saying many different things. Patients are often confused and scared. They hear information from their primary team. They hear information from the consultants. They often cannot distinguish between the two. They have other people who come in from nursing or respiratory services or nutrition. And you have to put yourself in their position and recognize that it is a very complex environment to be in. And quite often they're scared and confused. You can play a role, a very important role, in helping them to understand not only your role, but who else is on the team. So I'd ask you to focus on that. I'd ask you to talk to your attending about that. I'd ask you to clarify with the team you're working with what they think that is appropriate for you to do and what things they want you to bring back to them, so that the patient is getting a very clear and concise message from the source. So, and that's something that as you progress through your education from medical student to intern to resident to fellow to attending, each step along the way you'll assume more responsibility and your role will change, and therefore how you introduce yourself to the patient should change. And the last thing is patient safety. There are so many things that we as a medical center are focusing on relating to patient safety. Hopefully at some point Dr. Kilby will give me a chance to come back and talk maybe at length about some of those things. Let me give you two that I want you to focus on. The first one is very simple, and that's why I'm starting with that one, which is hand hygiene. This has been well proven, and obviously it's evidence-based that the more we wash our hands, the more likely we are to prevent the spread of infection throughout the hospital. This is a very basic concept. However, you may be surprised to know that our compliance rate with this is not 100%, not at this hospital and not at any hospital, but it should be 100%. I want you to play a role. The medical students historically have done a fabulous job of being the champions of hand hygiene. So I ask you to continue that tradition. Make sure when you walk into a patient room, you wash your hands. Make sure when you walk out of a patient room, you wash your hands. It's always very important for the patients to see you washing your hands if possible, because it demonstrates to them a level of professionalism, and they feel comfortable that you've done that before you've examined them. So I ask you to sort of champion that. I also ask you to find a way to encourage your colleagues to do that. So if there's another medical student who hasn't, you might want to use that opportunity in private to remind them that it's the best practice to do so, and we'd hope we would do that as well. The other thing I want you to focus in on is what I would call the universal protocol or timeout. And this is essentially a way of making sure that we're doing the right thing on the right patient at the right time with the right equipment, and everything else is in place. There are moments in the delivery of healthcare, whether it be at the bedside or in the operating room or in the emergency department, where we need all the members of the team to stop what they're doing and agree that we're doing the right thing by the patient with everything in the room. It's called a timeout. I want you to be an active participant in that process. This is not a moment where you are looking around the room or you're taking care of other business. If they ask for a timeout, that's exactly what it means. You stop what you're doing and you participate. And collectively, if we could all do that, that guarantees that everyone in the room knows what their role is at that moment with that patient, and therefore we can do the right thing. So I'm sure I could give you others, and as I said, if given an opportunity, I'm happy to come back. But in summary, let me begin by saying again, I said my regrets, I'm not there. I am the medical director of the hospital, but I am more than happy to meet with any of you at any time. Use your chain of command. If there's things that you'd like to bring to my attention, I'm more than happy to hear them. Again, I congratulate you on this transition phase, and I welcome you to third year, and I wish you the best of luck. Thank you very much.